Assalamu alaikum doctors. In this video I am discussing how can we take the developmental history. So as usual the development history also we start like history, and then the chief complaints present history we analyze this like what is when onset course and durations, how when it start the complaints like difficult walking or not talking properly like that, any problem, what did you do for that, did he lost any skills. So he has lost any skills, we know that Rett syndrome there is a lost skill present, and also Down syndrome with hypothyroidism, it can be lost skill, and also hypothyroidism common exam. So did he lost any skill, we ask. Any behavioral abnormality, could you describe his daily routine. So behavioral abnormality, ADHD patient, also there is come autism they have speech problems. So daily routine he stick with any specific toy. Now for the cause, for diagnosing the cause, we can ask the history of any head trauma, bug in the brain, head size and fits. So head trauma is important. Shaken baby syndrome comes on exam, and bugs in the brain, meningitis sequelae come on exam. There is maybe hearing problem the child has. Head size very important, and lots of syndromic feature plus rickets come on exams. So rickets has, we know that, frontal boozing. Any fits, history of any skin changes, skin stigmata very important, that is mainly the tuberous sclerosis come, which is associated with ASD, and neurofibromatosis, we know that. So skin changes also important. Also Sturge-Weaver syndrome come on exam, that has specific presentation of the skin. Then do you have any concern about hearing and visions? Okay, hearing vision I already tell, meningitis sequelae present, hearing affected. Does he looks like you or his daddy? If no, could you describe him for any? So that is for syndromic features. Lots of syndromic features come on exam. That is like Down syndrome, Williams syndrome, mucopolysaccharidosis, Russell-Silver syndrome. These are coming on exam. Now, so for systemic review only, there is, if we think that association present, like for the association of the case of in Down syndrome, if we suspect, that is cardiac and thyroid, we ask like any team is he following. Suppose he is cardiac, he Down syndrome diagnosed at birth, and the thyroid features we can ask, or any follow up. And also we know Down syndrome there is hypotonia, the mother explained that the baby is slow. Then CP child, what we ask, that gastroesophageal reflux disease, UTI and constipations, these are present. Williams syndrome, we ask about the P, blood pressure, neonatal hypercalcemia. Neonatal hypercalcemia present in Williams syndrome. For diagnosing, it's needed. And Fragile X syndrome, there is large ear and private area. Private part is also large. So Fragile X, we ask any unusual feature present or not. If the mother is telling that there is a large ear something, then that goes to Fragile X syndrome. Now about the perinatal history. Perinatal history is very, very important. Birth history in, it should need to take details in development history. So first from prenatal we start, prenatal maternal disease, maternal age and maternal drugs. So lots of disease associated with that, we know that. Then natal, like type of the labor, time, preterm or term, weight at birth, time of the first cry. So we know preterm also coming on exam. So preterm or term we ask, and first cry, that is perinatal asphyxia, we can exclude. Maternal age, lots of disease associated with maternal age, we can exclude. Then postnatal, any birthmark, NICU admissions, fever, fits, trauma. So postnatal trauma, shaken baby syndrome, we excluding any fever, any sequelae of meningitis, NICU admissions needed or not. Then past history 2T, that is which treatment he is taking and which team he is involving. And also IOA, that is any investigations done for that, when it started the problems past, and any admission needed or not, and what they do for that, we can ask. Now in history, we are asking the developmental history. First, go for the speech. So speech is two types, that is expressive and receptive. For expressive, we can ask like, can he sing a song? He can tell a story, how many color he knows, he can count to which number, and he can say his full name or not. Receptive, we ask like, when you talking to him, he use mine and yours. He can follow order of 3 orders, how many opposite he knows. So these are the for speech we can ask. Then the social, we check like how he feed himself. He can dress himself or not. He is dry by day or night. How can he share with toys to others? How he play. So social history, we can ask this type questions, and we know that is he shared his toys or not. That is one of the indication of autism spectrum disorders. Then we go the find method. So find method checking what history, what question we ask on the history. These are: he likes to draw, what he draw. If you give him cubes, what he will do with it. Can he thread like long or small beads? How he will turn pages of the book. By that we can collect the age of the child. Now for gross motor, what we ask that how he goes up and down in stairs. He can ride a tricycle, how he catch a ball, can he walk tiptoe, run tiptoe. So these are we checking for gross motor. Now family and social history will ask. Family we ask like describe your family for me. Any chronic disease in the family, your and his deity are blood related or not. What you are doing for life and his for living and his deity. Your income is satisfying for you. Any history of any developmental delayed in the family. So these are the family history we ask. Then school. Suppose he is Ahmed. Ahmed go to the mainstream school or any special school he is going. Did anyone talk to you about educational plans for Ahmed? What about his achievement and attendance in the school? Any bullying issue? So bullying issue, achievement, attendance, is the deterioration of the achievement, anything? That also us, because hypothyroidism, there is deterioration of the achievements present. About ask home. So home, what question you ask? Could you describe your home for me? Any special modification at home for Ahmed? Then the impact. Mrs. Bosi, would you explain how Ahmed disease conditions affect you and your family psychologically, and how this condition affect Ahmed psychologically? Then emergency plans. Do you have any emergency plan for him? Do you have health insurance? Do you have easy access to emergency room? Then about the siblings, we ask any of his sibling has same conditions or chronic illness. We know that lots of conditions that his siblings also affected. When you admitted with Ahmed, who will take care of other siblings? How his siblings dealing with him? So this is all about the development history. We can ask like that. Please do subscribe and share. MRCPCH with Dr. Emma Choudhury. Thank you.